It's the dawn of a new decade. You can be you again with Shatkin Mini Dental Implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how Shatkin Mini Dental Implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't eat almost anything.
I'm gonna go and get this done. Getting the mini dental implants was a life changer for me.
It's more affordable.
Very affordable. It's well worth it.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
Now I can smile and show the world.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It gave me the confidence to have my smile back.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
It was life-changing.
I don't know what else to say except it was almost a miracle.
It's just so much better.
It literally changed my life.
My dental implant has changed my life.
I'm excited to be me again.
I feel like me again.
It'll be the best, smartest move you ever made.
I love it.
It's incredible. It is. It's absolutely incredible.
Hello, everybody. I'm John DeSciullo. Welcome to Innovations in Health. I'm welcoming Dr. Charles Brandenburg from High Point Dental Care to the program. Dr. Brandenburg, welcome to Innovations in Health. Good to see you.
Good to see you, John.
We're going to talk about the mini dental implant procedure. It is something that will change your life. You can be you again. The mini dental implant is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And now, Dr. Brandenburg, you're going to tell us why. Because if you have a denture, particularly a lower denture that's sliding all around, this will offer stabilization. Show us how.
Sure, John. This is a lower denture model right here. So if you have a lower denture and it's loose, it's moving around and you can't chew properly, we actually place 4 little implants. It's called the mini implants. And we put those in the front part of the jaw and we can snap it right into your denture so it will not move again, so you can chew your food properly.
You know, so many people, I think, that have dentures, they're so used to that lower, just kind of swimming around on the gum, and they get used to that. And then they have to use all that goop, all that adhesive, and that gets into your system. You swallow it. It's just, oh, yuck. Now, with a mini dental implant, the goop, as we say, is gone.
The goop is gone, John, and we get testimonies all the time about patients being able to chew properly again once we put those implants in the lower jaw. Because that lower denture, because the tongue gets in the way, you cannot wear a lower denture properly. So the implants really help with that situation.
I couldn't eat almost anything.
I couldn't eat 3/4 of the food that I enjoyed eating.
But with these, I can eat everything.
It was done, over, done. Let's go home and eat.
I can eat steak, I can eat sandwiches.
I can chew a steak. I could not do that before.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
This is something that is so incredible.
It's made a tremendous difference.
I can eat corn on the cob now, which I never did before.
Best thing I ever did. I mean it.
I'm very, very pleased that I have them now.
It's going to sound corny, but I mean, it is a life-changing event.
It'll be the best, smartest move you ever made.
It's a wonderful thing.
All right, so there's a lower denture example. Let's take a look at an upper denture, because now, ladies and gentlemen, you can get more of that sensation of taste back.
Yeah, the upper denture is a little bit different. Sometimes we put 6 implants instead of 4 because we've got more room to work with. But here's the key to the upper denture. No longer do you have the palate. So we take the palate out of your denture, so that's not the gaggy reflex that you have when you have an upper denture is gone. So we put that right in just like the lower denture and snap it in without that palate, and you can taste your food better, and the liquids are much more enjoyable. Patients say all the time they just love having that palate cleaned out and stable so they can enjoy their food more.
So folks, if you're watching and you have a denture and you're having some troubles and you're thinking, well, this mini dental implant procedure is too good to be true. No, it is a revolutionary technique and it will really change your life in so many ways. But it's not just the upper and the lower denture. There's another example. It's almost as if you have a full set of teeth. Show us that, Dr. Brandenburg.
So if you want to move on to something more permanent where it's cemented in versus the dentures, we can use the same implants on the top or the bottom, and we have a bridge that is glued in. We put the glue inside the teeth, and that's glued in permanently, and it's snapped in, and you can chew your food and smile and never have to take them out again.
So, you know, God gave us our baby teeth and our adult teeth, and Dr. Brandenburg, you're going to give us what really looks like a 3rd set of teeth.
That is correct.
And we should talk about, folks, this titanium post, that's the metal that you see. That stabilization is so important because the denture or the cubic zirconia, which is what the tooth is made from, sticks to it, and the bone grows around the base of that titanium post. So once it's inserted into the gum, it actually gets stronger as time goes by.
Correct. When we put the implants into the bone, it actually keeps the bone healthy and strong for a long period of time, just like your natural tooth. When you don't have a tooth or an implant, the bone atrophies. It loses its ability to produce anything, let alone chew your food.
If somebody has a single tooth, show us how a mini dental implant can help.
This is a single tooth option, so somebody in the front gets their tooth knocked out playing hockey or baseball, whatever, so that tooth is gone. We can go ahead and put an implant right in that spot, most of the time the same day, and put a permanent crown back on that tooth so you have your tooth back just like it was when you were 15 years old.
Well, and what's nice about this, Dr. Brandenburg, that tooth is actually custom made for the patient.
Correct.
This is not something, folks, where Dr. Brandenburg takes it out of a box and puts it in your mouth. No, this is a made in America product, FDA approved, and that's custom made for the patient.
Custom made, just like and the final product looks just like the tooth adjacent to it, and the patients always love it because it feels with their tongue like a natural tooth.
Now, some people may say, all right, I have some teeth in the back and I've had troubles with them. Maybe they're missing or they have some issues, and they forget about it. They say no one sees it, so it's out of sight, out of mind. You are very passionate about the fact that the mini dental implant can correct teeth that are in the back, not just because of the way your jaw sinks in and the way it looks cosmetically, but for the health benefits of having those teeth. Tell us why.
John, before I became a dentist, I was a nutritionalist. So seeing as a dentist and a nutritionalist, the importance of chewing efficiency and able to digest your food properly. And as you see on the model right here, these are our first molars right here. And they erupt into the oral cavity at 6 years old. And a lot of people, as we age, lose those first molars. So when you lose your first molar, you lose the ability to digest food properly. So what happens is when you don't have the first molar, when you chew your food, most people only chew their food 2 to 3 to 5 times.
Everybody's eating fast.
Everybody's
saying
eating fast.
Slow down.
The ideal way to chew your food is 12 to 15 times before you swallow your food. Because when it gets to your stomach, it has all the good enzymes in it that when you chew your food properly is there to digest your food properly.
So show us how the mini dental implant works.
So if somebody doesn't have the first molar and maybe a molar's in front, we can put the implants right in that area and cement the bridge just like so you get your chewing efficiency back with the implant in the bridge.
It snaps right into place as well.
Snaps right into place.
So Dr. Brandenburg is here to tell us not only that this is going to look good, your health as a person and your life quality is going to elevate exponentially by using the mini dental implant procedure.
Oh, no question, because if you're only chewing your food 2 to 3 times, it's going to lead to chronic disease because you cannot process your food in your stomach because the enzymes aren't there.
Yeah.
And so a lot of chronic disease goes as correlation with bad chewing, bad teeth. People don't like to eat, so they're not getting good nutritious food. They don't like to eat.
This is an affordable option. You know, this is something where Dr. Brandenburg and his team at High Point Dental Care, and we should mention they're at 274 East Chester Drive, Suite 126 in High Point. This is an opportunity for you to go and talk to Dr. Brandenburg because you're going to work with the patient. I know that you have consultations that you have. What do you discuss with the patient when they come in?
Well, when patients comes in, our consultations are free. We like to take time and sit down and go over everything the patient's concerns are with their mouth, where they are with how many teeth they got, if they have any teeth, or if they have a denture that's not fitting properly. So we start at ground zero and make a treatment plan that fits best for them.
And you know, you should give them a call. If you're watching right now and you're thinking the mini dental implant technique is something that you could benefit from, the phone number is 336-265-6263, and the website is highpointminidentalimplants.com. That information here on the screen. But let's talk a little bit about you, Dr. Brandenburg. Where did you grow up?
I grew up outside of Baltimore, and I went to dental school in Chicago, and then I've been practicing dentistry for almost 30 years.
Yeah.
And I've been doing mini dental implants for almost 6 years.
Yeah, so you are the mini dental implant specialist here in High Point and Greensboro and the whole Piedmont Triad.
That is correct.
And you have an interesting inspirational story because your father was a dentist for a long, long time.
Yes, my father was a dentist. He graduated from the University of Maryland in 1954 dental school, and he practiced dentistry for 64 years.
Wow, that's terrific.
Yep, it was awesome. And so he gave me a lot of good foundation on being a dentist and how to handle the profession.
So when you became a dentist, obviously he inspired you. What was his reaction when you brought back the mini dental implant procedure? How did he respond?
His response was, I'm going to be your first patient. So when he was 87 years old, I put 14 implants in him, and he had them up to the day he passed away. So it was 5 years.
And I think that's important, not only because it was your father and you certainly had that connection, but you want to have a quality of life even at a time when people would say, well, I'm too old for that.
That's correct.
No, you don't need to have that sense.
Exactly, because as we get older, one of the joys of life for older people is being able to chew and have fun, have a good time eating and enjoying that. And we can really add that back to their life.
So imagine, folks, again, that ear of corn, that apple that you've been craving, you bite right into it, you get all the juice and you crunch it, and you have no fear that the denture is going to fall out.
No question, because when you put these implants, dentures in, they're going to snap in and they're going to chew your food. You can have steak, you can have salad, you can go to the ball game, have peanuts, and not have to worry about it.
You have a great team in your office as well.
Have a great team, and they will be more than happy to take care of any needs that the patients have when they call.
And here in High Point, Greensboro, we have a lot of great people here in the Piedmont Triad, and you see a lot of people from all over. If somebody has not been to the dentist and they're watching, you welcome patients for not just the mini dental implant, but other procedures as well.
Yeah, we have a full array of treatments we do. We take care of fillings, crowns, dentures, extractions, so we cover a lot of bases.
Yeah, and if somebody has had a conventional implant, which is the older way of doing an implant, you'll actually help restore the tooth if there's a problem.
Oh, no problem. We will take care of the conventional implants. If that's what they want, we can restore it, and we add many. I've done many cases where I've had mini implant right next to conventionals, and they work fine.
Now, the mini dental implant, as we said, is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And when we talk about the expense, you're making this affordable for your patients here in North Carolina.
Yeah, well, we offer financing through Care Credit, and so the patient can really get their payments down, very reasonable per month payments, so it works well.
Yeah, and we're all interested in making sure life is affordable, and we're paying for our cars, some of us monthly, we're paying for a major appliance, paying for other pieces of our lives. This is an investment in yourself. This is something where you should look at this and say, okay, I'm going to do this, and I can afford to do this, and Dr. Brandenburg and the team at High Point Dental Care are going to make this work for me.
We most certainly will. Whatever the patient needs, we will try to work with them to make it so they get that mini implant, denture, or bridge that they so badly need and want.
It's so interesting, Doc, because when the patient walks away with the mini dental implant, they really do feel that sense of renewal. Talk to us about some of the patients that you've worked with, and because you have some amazing stories.
Yeah, it's really very, very rewarding to some of the patients that we've provided the implants for. I talked earlier about my dad. His last 5 years of his life, he had 14 implants that he knew he didn't want a denture, and he was able to chew his food and enjoy steak and being able to talk without worrying about dentures moving around. And one other gentleman I had, he had a hard time in life. He had throat cancer, and he grew up in a town where it was rampant, and 4 of his buddies had it, and he was the only one who survived, and he survived it by 10 years past what they did. And he came to my office with not being able to eat food for 10 years, and been to every dentist and doctor all the way around in the country to try to figure out how he can chew food, and nobody had any solutions. And that's where many implants came in and just saved this man from further agony. And so we worked on him, and we got him back where he got the set of bridges for top and bottom, and he was able to chew his food again. And it was pretty dramatic.
I think, Dr. Brandenburg, you're being very humble, because I know in the conversations we've had, he said to you, you have to take my case. You have to help me.
Correct.
And you did.
He was so happy at the end of the day. He had tears of joy, and our staff had tears of joy for him.
Absolutely.
Because he was able to chew his food again.
Now, that's a dramatic example, but there are other examples too. In fact, let's take a look at some of the other folks that Dr. Brandenburg and High Point Dental Care have helped.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
I feel like me again.
After the procedure, wow. Yeah, you smile.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
Many dental implants have changed my life.
Changed my life.
These are amazing stories. Dr. Brandenburg, you have some other testimonials as well, some other patients that you've worked with. Tell us about them.
Yeah, one of the great things that Mini Implants offers is a patient will come in, a lot of times, you know, they'll come in when we're getting ready to close at 3 or 4 o'clock and they broke a tooth off and it's Friday afternoon, and what do? And one example was I had a young lady who came in and she had a big shindig on Sunday at church. And it was Friday afternoon and her front tooth broke in half. And when she smiled, she didn't look pretty. And she knew it and she was really upset. And she came and Dr. Brandenburg, what do I do? And so, needless to say, we could, with Mini Implants, what we did is we placed an implant right where that front tooth was. And 20 minutes later, she walked out with that tooth replaced with a crown on that tooth, and she could go to her big shindig on Sunday, and she was so happy. It was unbelievable.
So here's somebody that comes in on a Friday.
Correct.
Toward the end of the workday, big event on a weekend, and you fixed a single tooth in one visit.
Within 30 minutes.
Within 30 minutes.
Correct.
That's the revolutionary procedure called the mini dental implant, and it can change your life. Tell us about your trips up to Buffalo, New York to learn all about it.
Dr. Todd Shacken is in Buffalo, New York, and he is the innovator. He and his father, who was a dentist, an oral surgeon, and a medical doctor, they help with the innovation of mini implants. And Dr. Shacken gives seminars about once a month throughout the whole year. And I try to go 3 or 4 times a year at least to continue to learn something new every time and sharpen my skills so we can provide better service for all the patients that we do have.
So you get all of that information and you bring it right back down here to North Carolina and share it with everybody here in the Piedmont Triad. So, you know, ladies and gentlemen, you're getting the very best information, you're getting the latest technology when you go to see Dr. Charles Brandenburg and his team at High Point Dental Care. Here's the address again, 274 East Chester Drive, Suite 126, and the phone number is 336-265-6263, and the website is highpointminidentalimplants.com. And Dr. Brandenburg, if somebody's watching and they haven't been to the dentist in a while, they may not need a mini dental implant. They just may need to go to the dentist. Why do people fear going to the dentist?
Well, to be honest with you, a lot of people fear dentists because they're embarrassed. They're embarrassed the way their teeth look. I get all the time, a patient sits in a chair and says, my teeth are really bad, I'm embarrassed to even smile. I mean, to even have a dentist look at them. So there's a big embarrassment phobia that's why they don't go. That's one reason. And a lot of people, what brings people to dentists is they're in pain. And so we have to work through the pain first before we can offer any kind of implant or any other kind of treatment.
Pain is really not a part of the process anymore. Things have advanced so greatly that the patient doesn't need to fear that.
No, they don't need to fear anymore because we have a lot of solutions for the pain, and it's not that, you know, we can cure everything with pain, but there's a lot of new technology in dentistry that we can help a lot of people.
This is a real passion of yours because we talk about how you can enjoy food all over again, and I can't imagine not being able to bite into a steak or an ear of corn or an apple or any kind of food, like you mentioned, you know, peanuts at the ballpark. But again, this part of the process is so key because your whole body and the health of the human being is really generated by the tooth on down.
You know, people will have stomach aches. They got indigestion, constipation. These can all be by not being chewed food up properly. So when we take care of that, you know, what goes on in the North Pole can help what goes on in the South Pole. Okay. So when you combine that ideology, you're going to take care of a lot of patients.
I like that analogy, Doc. That sounds like
it's so true.
Yeah. And when we talk about the mini dental implant, and the denture that the person may have already might work, but if it needs to change, you can make that change as well in your office.
Oh yeah, we can use the existing denture that the patient has. We can build that up. If they don't need a new denture, we don't have to necessarily make them a new denture. We can use their denture to put implants in, and that cost goes down when that happens. Or we can build them a total new denture to the new implants if they so desire.
And that titanium post, and we'll get into the models again, but that titanium post is really key. It holds the denture in place, it holds the cubic zirconia in place, and this cubic zirconia is up for the challenge.
It's up to the challenge. It all goes to one. The crown, the implant, and the bone, all three in one make it work better. Because when you stress the bone from an implant, that bone gets stronger. It's just like lifting weights. The more you lift weights, the stronger that bone and muscle gets. When you chew your food, when you put stress on that crown and it goes down, that stress all the way down into the bone, it gets stronger. And that's what we look for.
And folks, this is something where you can take an Advil or an ibuprofen and overnight, and it feels so much better the next day.
95% of the time, the next day, it's almost gone. It's not even an issue.
So now somebody has their new mini dental implant. And whether it's a denture that's stabilized or it's the full new set of teeth, how do they care for the mini dental implant?
Yeah, so the most important thing is the number one of any failure to most implants, number one failure is hygiene. Just like brushing your teeth and flossing your teeth. If you don't brush and floss your teeth, you're gonna have tooth problems. Same with implants, you gotta keep them clean. And so we always give a patient a water pick. You come in my office and you get an implant, you're gonna get a water pick because we want that implant to succeed. If you use that water pick, it's gonna take care of it. The other thing a patient gets with all my patients is a bottle of bone meal. And that bone meal allows that implant and your bone to grow together properly. So they get those two products together because we want that to work. We want the implants to work and that patient to have a good time chewing their food.
Yeah.
And success is what breeds that.
So if you're watching, folks, and you're in Greensboro and High Point, anywhere here in the Piedmont Triad, if you're just tuning in, we're talking about the mini dental implant. It's something that's going to change your life. And if you've been here with us for the whole half hour, you've seen an example of some of the models, but I think it's important to show them again because now it's really going to make some sense. And we're going to start with the lower example of a denture. So folks, you have that lower denture and it's swimming around on the bottom of your gum. Look at how the mini dental implant will stabilize this.
Yeah, here's your lower denture right here. When we have inside the denture, we have the housings, and then the implants fit on your lower jaw.
Little O-rings there inside the...
O-rings are these, we call these housings inside, and then the implants, they fit, they slide right in very comfortably for the patient to chew.
Listen to that snap. It snaps right into place. That feeling of confidence is back, and it's not going to fall out. That's incredible.
Yep, I always call it two snaps. One snap in, the other snap when you bite that peanut, you get that snap. You can't get that with a denture.
Yeah.
You got to have the implant denture.
So now you have an upper, okay? And that upper is covering the palate and it's covering that portion of the mouth that all this taste sensation comes from. Now it's all back.
Yeah, so we have the upper denture with no palate. If you have an upper denture, you know how uncomfortable having a full denture in. Well, with the implant dentures, you have no palate. So you really can taste your food and you can enjoy your coffee 10 times better when you have this kind of a denture. And that snaps in just like the bottom.
And you know, folks, if you're used to the denture and you're thinking, this isn't for me, it is for you. This is something where I have found over the years that some people who have dentures just sort of accept the fact that they have to have it this way and that's the way it's going to be. But you don't have to resign yourself to that kind of life.
Well, John, I've never had a patient that I've done denture stabilizations come back to me in 6 weeks and say, I want my old dentures back. Because they know what it is to have a better being able to chew.
And this, again, is something that can take place in your office in a very short period of time.
Very short period of time.
So what is their reaction, the denture patient, when they get the mini dental implant and they can taste again? It must be miraculous.
Oh, that's unbelievable. Most of them go out that day and have it. Oh, I always tell them, go if you like steak, go eat a steak. If you like salad, go eat a salad. Those two things that are hard to chew with dentures, and they can always come back and say, I chewed my steak and I enjoyed my salad.
Yeah. And you shouldn't be embarrassed if you have a denture and you need to have it fixed. It's okay, come on in.
That's exactly right.
Yeah.
No question.
But if somebody has, as we talked about earlier in the program, a problem where maybe all of their teeth need to change, you have an example, and this is almost as if God gave us another new set of teeth. Again, show us why.
Yes, because this is a full bridge. So basically, when you look in the models, when it snaps into it, the glue goes inside these teeth, and then that's a permanent bridge like your smile was when you were 20 years old.
So even if you have dentures, you could upgrade and get this and really feel different because you don't have as much plastic in your mouth, and you don't have the issue where you're taking them in and out.
Right.
But this case is as if a full set of teeth, upper or lower or both.
Full set of teeth. We have patients who get the mini implant dentures and they come back later on and get the bridge because they want to go upgrade. We can do that too with the same implants. We don't have to put new implants in. We can use the same existing implant. That's the beauty of it.
Yeah.
We don't have to go back and put new implants in.
And again, this is a procedure that happens in the office.
In the office. We don't go anywhere. Just local anesthetic, and it's taken care of.
Yeah. And that office is at 274 East Chester Drive, Suite 126 in High Point. Phone number 336-265-6263. Let's take a look now, Dr. Brandenburg, at a single tooth, because I know you've been coaching baseball. I know you give a lot back to the community you have with coaching baseball and you know, giving back to the young people here in the Piedmont Triad. And I bet that I know you've seen some teeth that have been knocked out as a result of some baseball.
Oh, yeah.
But it's not just baseball. It could be any kind of an injury. Show us how that single tooth can be changed.
Yeah. Look at this, John. This is a most common one is the 4 teeth in the front. They get knocked out. Or these been treated over the years. They got a crack in it that somebody got hit in the mouth in a fight or a baseball or a hockey puck. And we got to restore them because nobody wants to go around looking like Godzilla. Right. And so we can put an implant right there, and the same day we can put, if not a permanent, we can put a temporary crown, and the permanent crown snaps in just like that.
So take a look at that, everybody. That tooth is snapped right into place, and it looks just like the other teeth because it's custom made for the patient.
Correct.
And we talked about the importance of those side teeth. If you have teeth in the back and they are a problem, you have to get them fixed. Your jaw will sink in. It won't look good. And this is an investment in yourself, because if you have a relationship you're getting into, a new job, if you just want to feel better in life, you know, I had some major dental work done. You feel terrific. Show us how the side teeth can be impacted by the mini dental implant.
Well, once again, John, the first molars, this is the workhorse of the mouth. If you do not have your first molars, you are going to be deficient in chewing, period. There's no hands down about it. So if you do not have a first molar, we can provide that back with a single implant, with a bridge, or with dentures with the implants. So you can chew your food better. Without that first molar, you're swimming uphill trying to chew your food.
Yeah.
This patient is missing the first molar right here. So when we restore that first molar, we obviously put some more teeth on that. That's a bridge. So if you're missing some teeth here on one side, that's an easy fix for mini implant.
And it looks great. Tell our viewers why they should not put this off.
Well, because if you put it off, you continue to not chew properly. And if you're not chewing properly, here again, chronic disease is going to settle in. If you don't have already stomach issues, you're going to get stomach issues if you can't chew right.
Yeah. And you know, because you had a background in nutrition. You were a nutritionist in addition to being a dentist.
Correct.
Yeah.
And I've seen that all the way through the years.
Yeah.
And that's why mini implants, to me, made a big green light. You can really help a lot of people because a lot of people have digestion problems.
Well, the mini dental implant, it's a procedure where you can be you again. It's new technology, and it's available at High Point Dental Care. Go and see my friend Dr. Charles Brandenburg, 274 East Chester Drive, Suite 126 in High Point, close to everything. The number 336-265-6263, highpointminidentalimplants.com. So when you played baseball, Dr. Brandenburg, what was your position on the team?
I played a little bit of everything, shortstop, pitcher, you know, I enjoyed hitting. Yeah, that was all fun.
Yeah, so we'll say that the mini dental implant is a home run?
You got it, it's a home run.
It's a home run. All right,
question.
thanks for joining us on Innovations in Health.
Thanks, John.
And thank you for watching.